lives, there's two things that are apparent. One, the vast majority of them had not been vaccinated, and so that's the vaccine is kind of the prevention angle. But then also, over 90% of the people who were being admitted did not get a monoclonal antibody treatment after they were infected. And so from both a prevention and a treatment, you see kind of who's making up the bulk of the hospital admissions. It's our belief, based on the data, that if more people knew about this and had done it, that the admissions would have been lower. And we think with more uptake on this, we think the admissions will go lower here in the future. And so the monoclonal antibody is it's a treatment. It's for people who particularly are at severe risk of COVID. It's authorized not just for a treatment for infection, but it's even authorized as a prophylaxis if you've been exposed to people who have COVID. And so this is something that comes up when you're talking about nursing homes. If you have a nursing home resident or staff member who tests positive for COVID, the close contacts, you can then go in and do the Regeneron as a prophylaxis, and it helps ward off a potential infection. And then obviously, if you are infected, could treat it on the back end. So those are the two ways to be able to use it. This is a treatment that is free to the patient. It's important to do that because there's people that say that this is costing thousands of dollars out of pocket for people. That is not true. The federal government purchased the whole lot of this as soon as it was developed, and basically have been sending it down. So whatever Florida draws down, we don't pay for, and then whatever patients get, they are not charged for this treatment. And so it's important for people because you don't want people to be deterred from doing this if it's something that could help them. The key to this, though, is doing it prior to severe illness setting in.